Hi there and welcome to our channel. Today, I wanted to take some time to talk about a disease that affects just a few people in every million. Have you ever heard of aplastic anemia? It's a rare and serious condition that affects the bone marrow and can lead to life-threatening complications. But don't worry, in this video, we'll be exploring everything you need to know about aplastic anemia, from its causes and symptoms to its diagnosis and treatment options. So, if you're interested in learning more about this rare blood disorder, then be sure to hit that subscribe button and turn on notifications, because we'll be uploading new videos every week with the latest information on health and medicine. What is aplastic anemia and what are its symptoms? Aplastic anemia is a rare disorder that occurs when the bone marrow is unable to produce enough blood cells. It affects both men and women of any age, but it's more common in people under the age of 30. The condition is caused by a variety of factors, including exposure to certain chemicals, radiation therapy, and infections. The most common symptoms of aplastic anemia are fatigue, weakness, and shortness of breath. Other symptoms include frequent infections, fever, and a tendency to bruise or bleed easily. If left untreated, aplastic anemia can lead to serious complications, such as bleeding disorders and infections. Fortunately, there are various treatments available, such as blood transfusions, bone marrow transplants, and immunosuppressive therapy. The type of treatment recommended depends on the severity of the condition and the patient's overall health. Aplastic anemia is a rare and serious condition that occurs when the bone marrow is unable to produce enough blood cells. There are several different factors that can cause aplastic anemia. In some cases, it may be caused by exposure to certain chemicals, such as benzene, which is found in gasoline and other industrial products. Other potential causes include radiation therapy, chemotherapy, and viral infections such as hepatitis or HIV. In some cases, the cause of aplastic anemia is unknown, and it may be referred to as idiopathic aplastic anemia. It's important to note that while some risk factors for aplastic anemia, such as exposure to certain chemicals, can be avoided, others such as viral infections may be difficult to prevent. If you suspect that you or someone you know may be at risk for aplastic anemia, it's important to talk to a healthcare provider who can help determine the underlying cause and provide appropriate treatment. Diagnosing aplastic anemia usually involves a combination of physical exams, medical history, and blood tests. A healthcare provider will typically begin by asking about symptoms and any potential risk factors for the condition. They may also perform a physical exam to look for signs of anemia or other health issues. Blood tests are a critical part of the diagnostic process, and they can reveal a range of information, including the number of red and white blood cells, platelets, and the presence of any abnormal cells. In some cases, a bone marrow biopsy may be necessary to confirm a diagnosis. During this procedure, a small sample of bone marrow is taken and examined under a microscope. This can help to determine the number and types of cells present in the bone marrow, as well as identify any abnormalities that may be causing the aplastic anemia. If you suspect that you or someone you know may have aplastic anemia, it's important to talk to a healthcare provider who can help with the diagnostic process and provide appropriate treatment. In general, the prognosis for aplastic anemia can range from excellent to poor. For patients with mild to moderate cases, the outlook is usually favorable, and they can often achieve remission with the help of treatment. However, for patients with severe cases of aplastic anemia, the prognosis is typically more challenging, and the condition may require more aggressive treatment options, such as bone marrow transplantation. Age can also play a significant role in determining the prognosis for aplastic anemia. Younger patients, especially those under the age of 20, tend to have a better prognosis than older patients. Additionally, patients with certain genetic conditions, such as Fanconi anemia, may have a worse prognosis. The cause of the aplastic anemia can also impact the prognosis. If the condition is caused by exposure to toxic chemicals or drugs, removing the source of the exposure can improve the patient's outlook. However, if the condition is caused by an underlying medical condition, such as leukemia, the prognosis may be less optimistic. There are several treatment options available for aplastic anemia, depending on the severity of the condition and the patient's overall health. One of the primary treatment options for aplastic anemia is immunosuppressive therapy. This involves the use of medications that suppress the immune system, which can help to prevent the destruction of blood cells. This therapy can be effective in achieving remission in many patients with mild to moderate cases of aplastic anemia. Another treatment option is bone marrow transplantation. This procedure involves replacing the damaged bone marrow with healthy bone marrow cells from a donor. This option is typically reserved for patients with severe cases of aplastic anemia or those who do not respond well to other treatments. Blood transfusions are also commonly used in the treatment of aplastic anemia. This involves receiving a transfusion of red blood cells, platelets, or both to help replace the blood cells that are not being produced by the bone marrow. In some cases, medications such as growth factors or steroids may be used to stimulate the production of blood cells in the bone marrow. This can be effective for patients with milder cases of aplastic anemia. One of the primary differences between aplastic anemia and other types of anemia is the underlying cause. Aplastic anemia is typically caused by damage to the bone marrow, which can be due to exposure to toxic chemicals or drugs, radiation therapy, or an underlying medical condition. In contrast, other types of anemia can be caused by a variety of factors, including iron deficiency, vitamin deficiencies, or genetic disorders. Another difference is the symptoms associated with aplastic anemia. In addition to the common symptoms of anemia, such as fatigue and weakness, patients with aplastic anemia may also experience bruising or bleeding easily, frequent infections, and a rapid heartbeat. Treatment options for aplastic anemia also differ from those for other types of anemia. While other types of anemia may be treated with iron supplements or dietary changes, aplastic anemia typically requires more aggressive treatment options, such as bone marrow transplantation or immunosuppressive therapy. Unfortunately, there is no known way to prevent aplastic anemia from occurring. However, there are certain measures that can be taken to reduce the risk of developing the condition. Firstly, avoiding exposure to toxins and chemicals is important. Some chemicals such as benzene and certain pesticides have been linked to an increased risk of aplastic anemia. Therefore, it's essential to take proper precautions when working with or around these substances. Secondly, taking steps to maintain good health and immune function is also important. This includes eating a balanced and nutritious diet, exercising regularly, getting enough sleep, and managing stress. Thirdly, certain medications can also cause aplastic anemia as a side effect. It's essential to talk to a doctor or pharmacist about any medications being taken and to follow the prescribed dosage and instructions carefully. Lastly, genetic factors can also play a role in the development of aplastic anemia. It's important to know the family history of the condition and to discuss any concerns with a healthcare professional. Thank you for watching this video about aplastic anemia. We hope that it has provided you with valuable information about this rare and serious blood disorder.